forum for this week. Today, we would like to highlight a topic that is quite interesting to be discussed on: benefits of animal vaccination on animals and humans. By the way, today's forum is sponsored by Mary. I am sure that every one of us has our own opinion and do with this topic. Before we proceed to our forum, I would like to introduce our panelists today. Our first panelist is Dr. ZIKRI, President of National Animal Welfare. How are you today, Doctor?
I'm good.
Next to him is our specialty panel 2, Datuk Nur HAKIMI, Managing Director at Farm Fresh Company. Also, we have Datin Farah Amanina, Vice President of Department of Veterinary Service. Before we start our forum in details, let me ask the panelists about our topic today.
So, animal vaccine play a key role in protecting animal health and contribute to public health through a safer food supply. They also help to reduce the need for antibiotics by preventing disease that might otherwise require antibiotic treatment. So, Datin Amanina, what do you think about this?
Okay, so vaccinations are commonly used to protect pets from highly contagious and deadly viruses such as rabies, parvovirus, distemper, and hepatitis. Livestock and poultry such as chickens, turkeys, pigs, and cattle are vaccinated to protect against diseases like rotavirus, E. coli, pink eye, and tetanus. What do you think, Dr. Hakimi?
Okay, thank you, Datin. Unlike the decision to vaccinate dog and cat which live with the animal owner, the decision to vaccinate livestock can be much more complex decision process.
Thank you, our panelists, for the elaborations. What is the characteristics of ideal vaccines that people should know? Let's hear from the first panel.
Thank you, moderator. So, the question asked is, what is the ideal vaccine that made up for the vaccination? So, the ideal vaccine is discussed under 4 headings. The first one is, it must safe. Vaccine evaluation and selection must undergo a rigorous review process by experts to ensure its safety. The vaccine must not evoke an adverse reaction or effects and does not increase susceptibility towards other disease. So the second one is, vaccine needs to be effective. An effective vaccine should be able to elicit appropriate immune responses and be able to protect against diseases. Effectiveness of that vaccine also should cover the long life protection after a single administration. Point number 3 is stability. The vaccine should be able to retain its safety and effectiveness in field environments. Vaccine should be able administered to immune-competent and compromised recipient with no side effect or no allergic reaction. So the last one is, vaccine should be affordable and accessible to protect as many people as possible in the shortest possible time.
Thank you, Dr. ZIKRI, for the elaborations. Let's move to the next panel, Datuk Nur HAKIMI. Are there any types of vaccine?
There are 4 types of vaccine. First, bacterial vaccine that contain kill or attenuated bacteria that activate the immune system. Next, killer vaccine or inactivated vaccine. Inactivated vaccine are composed of dead or inactivated virus and bacteria and therefore differ from live but attenuated vaccine. After that, live vaccine produced by growing a live culture of the virus. And lastly, attenuated vaccine or modified live vaccine is a vaccine created by reducing the virulence of a pathogen but still keeping it viable.
Thank you, Datuk. Datin Farah Amanina, may I know, is there any ways or method to administer the vaccine?
Okay, so farmers can actually vaccinate their animals themselves, and there are few ways to inject their animal with the vaccine. So the first method is by subcutaneous, or we call it subcut. The vaccine is injected into the fat tissue under the skin of the animal, made in any area where skin fits loosely, such as neck, chest wall, or flank. Dosage is deposited under raised skin, and the area is then massaged to facilitate distribution. There are specific instructions for farmers on how to do it, so don't worry, they are not just winging it. And the next method is intramuscular, or we call it IM. As the name states, it means the vaccine is injected into the muscles, made deeply into large muscles with needles at least 3/4 inch long, not placed in high-price meat areas, which can damage the muscle tissue. The third method is intraperitoneal, which is IP, made into the right flank at the point in the center of triangle formed by the loin, last rib, and line from the top of last rib to hip bone. Lastly is intravenous injections, which require the vaccine to be administered directly into the vein. In this case, the farmers actually need training beforehand.
So then, how does the vaccine actually works?
So do you guys know how does the vaccine really works?
Yes.
Oh, I don't know.
Okay, let me tell you how does the vaccine works. Okay, so vaccine exposes the animal to parts of pathogens, challenging the immune system to react to a possible pathogen invasion by creating memory cells for the antigens belonging to that specific pathogen. In the future, if the animal is exposed to the same pathogen, the immune system will quickly generate a response before the pathogen can cause disease. Each antibody is usually specific for only one antigen. Because of this, the immune system keeps a supply of millions of different antibodies on hand to be prepared to overcome any foreign invader. For a naive animal, which is an animal that never was exposed to the pathogen, it may take 7 to 14 days after exposure to an infectious agent to the body to develop immunity to an antigen, which is plenty of time for some pathogens to wreak havoc on the body. On the other hand, it often takes only 48 hours to mount an immune response to the same antigen in a vaccinated animal.
And how does the vaccine benefits to both animal and humans?
Okay. Advantage of vaccine is to protect you by creating an antibody response without you having to experience potential severe illness. So the second one is, may I ask Dato' Hakimi, have you ever heard about immunity herd?
Yes.
Okay, so basically, vaccination protects the vaccinated person and those around them who are vulnerable to disease by reducing the risk of disease spreading among family members, schoolmates, colleagues, friends, neighbors, and the society. However, people cannot rely on community immunity itself for some infectious disease. For example, tetanus can be encountered due to common injuries including dog and cat bites. Vaccination is the only way to ensure direct protection against tetanus. The third one is immunization program helps to reduce the social and physiological and financial burdens of disease on people and governments. Besides, it helps to reduce pressure on healthcare and social care system by enabling people to pursue productive activity including education and employment. Lastly, animal vaccination are efficient tool for protecting animal health and their welfare.
Vaccine do have some risks for adverse reaction, the most common being redness and soreness at the injection site or fever and allergic reaction. More serious complications like seizures and the neurological condition which is Guillain-Barré syndrome are also reported but occur very rarely and far less commonly than the complication and death from vaccine preventable disease. After that, over-vaccinating on the livestock can lead to the formation of chronic disease conditions such as skin inflammation, intestinal disease, autoimmune disease, behavioral change, seizures, and cancer.
From your explanation, Doctor, you strongly agree that the vaccination towards animal is good. And also thank you, Dato'. That was a great point to be said. What can you say, Datin, about the issues in our topic today?
Okay, so there are also some issues about zoonotic illnesses in domestic animals. So some zoonotic illnesses can also be spread through food consumption, underlining both the importance of good animal health as well as upholding good food handling, hygiene, storage and preparation standards. Some illnesses can be spread via close contact with animals or between wildlife and domestic animals, bringing it to the general public. An important measures taken to prevent diseases in both animals and people is vaccination. As with people, vaccines protect animals before they become ill, minimizing their suffering, but they can also protect us from illnesses. Some zoonotic pathogens like Salmonella may not cause serious health issues in poultry. For example, by encouraging Salmonella vaccination in poultry in the early 2000s in Europe, this proved to be an effective measure in tackling the disease occurrence in people. Thanks to the EU coordinated awareness programs, with poultry vaccination as a key element, there was an almost 50% drop in cases in the first decade of the 2000s. Animal vaccinations are efficient tools for protecting animal health and welfare, protecting public health, and also for reducing the need to treat animals with medicines.
Sorry for interrupting. And yeah, I also heard about financial cost issue, which is financial cost of infectious disease carried by animals. Foot and mouth disease (FMD) alone, for example, is estimated to cost up to $21 billion annually in countries where the disease is prevalent, even though an effective vaccine exists. And even though FMD has a little effect on the public health, nobody can ignore the economic impacts or forget about the widespread culling of animals during the 2001 UK FMD outbreak, when over 6 million animals were slaughtered. Decision to vaccine farm animals for specific disease at specific time clearly require more thoughtful decision at all levels. As with the growing public interest in animal welfare, society will no longer accept the culling of millions of animals due to preventable disease. And in case of animal disease outbreak for which no vaccine exists yet or still in development, like with African swine fever, there is a clear need for greater investment in research and development alongside fast-track approval. Poland identified its first case of African swine fever (ASF) in 2014 and has witnessed outbreak of ASF on more than 410 domestic pig farms by Q4 of 2021, resulting in huge economic losses and the culling of thousands of wild boar and domestic pigs.
Okay, wait, doctor. Before that, even I have vaccine, I have a question I want to ask to you. Even I have vaccine all my livestock like goat and cow, but they are still attacked by the disease. So, what about this kind of situation and what is your opinion about it?
Okay, so as I mentioned earlier, vaccination is a way of prevention from any mass losses and severe illness. So in this case, some of your animals might get infected even though they are all already administered the vaccination, because this is just a way of prevention. Based on my study, this cause of outcome may arise from its surrounding environment and hygiene issue. So maybe Dato can improve on that issue in the next time.
Okay, thank you, doctor.
So thank you for the informative and interesting talk. Alright, ladies and gentlemen, now we come to the question and answer session. We have a few questions from the audience. So the first question is, vaccinating the right animal at the right time. Can you elaborate what this statement means?
Okay, to determine the best time to vaccinate animals in your herd, first, write down the breeding and calving seasons, and then schedule vaccinations and other management events. Most recommended vaccines are best given at specific ages or at specific times as related to management and reproductive cycles. For example, black leg is a rapidly fatal disease of cows. Cows should be vaccinated for black leg by 3 to 4 months of age when the temporary immunity from the dam has declined and the cow's immune system can respond to the vaccine. To conclude, vaccinations depend on the age of the animals and type of the vaccine that wanted to be administered.
So the last question is, do you agree that animal plays important role in COVID-19 vaccine development?
Thank you for the question. As the global COVID-19 pandemic continues, safe and effective vaccines are playing a pivotal role in preventing severe disease and death and limiting the spread of SARS-CoV-2, the virus that caused the COVID-19 itself. Animal research play a key role in developing a successful vaccine for humans. Before promising vaccine candidates can be tested in humans, they must first be tested for safety and effectiveness in animals as required by the US Food and Drug Administration. Mice are frequently used because they produce rapidly, have a well-characterized immune system, and a defined genome. Some labs turn to mouse model of infection early in the COVID-19 pandemic, only to find that mice do not get infected with SARS-CoV-2 virus. SARS-CoV-2 virus does not bind to mouse cell because the ASC2 protein are different. Scientists created mice that express humans ACE2 and can be infected with SARS-CoV-2. Infected genetically modified mice lost weight and get sick like human. Research used mouse model to study COVID-19 symptoms and progression.
However, I beg to differ. In my opinion, animal testing is costly both in terms of time and money, especially when it requires genetically modified animal to be bred for use. The use of animal therefore doesn't lend itself to the challenging task of creating and distributing a vaccine within a short time span. Some countries have carried out clinical trial on human with minimal safety testing on animal first. Instead of using animals to test vaccine, newer models involve the use of tissue cultures or computer software. Healthy or diseased humans are also used to complement findings from other methods. Whatever the method, new interventions are judged according to their level of efficacy, safety, quality, and ability to yield useful drug targets.
So we can conclude that vaccines have widespread effects that are difficult to quantify, assess, and communicate. Finally, we have come to the end of our forum for today, where we have shared a lot of knowledge that we did not know before. In closing, once again, I thank the ladies and gentlemen for today and also to our panels. A billion thanks are dedicated to everyone for joining up this forum for today. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh. Bye.